Welcome to the Deep Dive. Today we're tackling a topic that's really fundamental to making healthcare work better. Quality improvement. QI, as it's often called.
Wait, QI.
Now, we know you, our listener, want to grasp important subjects, get right into them, but, without getting totally swamped in details.
Yeah, cut through the noise.
Exactly. So this deep dive is specifically for you. Our mission today is pretty straightforward. Understand what QI really is, why it matters so much in healthcare, and how organizations actually approach it.
Get a practical feel for it.
Right. And we've pulled together insights from some key places. Accreditation bodies like the Joint Commission, NABH over in India.
Okay.
A healthcare consultancy called Supremediq, and of course the core principles behind QI itself.
Sounds good. A good mix.
Okay, let's dive right in there.
Yeah, let's do it. Think of this as your streamlined guide. Quality improvement, at its heart, it's a practical approach, very data-driven, and it's really focused on one key question, fundamentally. How can we do this better?
Simple but powerful.
Exactly. It's about systematically making healthcare processes better, which, ultimately leads to better patient outcomes, a better experience for everyone.
And it's not about pointing fingers, right?
No, absolutely not. The key insight here is that QI isn't about blame. It's about getting better results driven by actual data, not just, hoping for the best.
And when we say better, that covers a lot of ground, doesn't it?
Oh, absolutely. A huge range.
I mean, from preventing serious medical errors, making surgery safer,
Crucial stuff.
to those things that really impact the day-to-day patient experience, like how long you wait in the ER, or how clearly your doctor explains things.
Yeah, those things really matter.
It's easy sometimes, I think, to see QI as just, more paperwork or endless meetings.
The bureaucratic side.
But it sounds like it's really about making tangible, positive changes.
Yeah.
Things that genuinely affect people's health and well-being.
That's exactly it. Real-world impact. And, to really get QI, it helps to compare it, maybe contrast it a bit, with quality assurance, QA.
Okay, QA versus QI. How do they differ?
Well, quality assurance is mostly about checking if standards are being met, making sure things are up to snuff. Think of it like a safety net.
Maintaining a baseline.
Exactly. Maintaining a certain level. QI, though, is much more proactive. It's forward-looking. It's about constantly finding ways to raise the bar, even if those basic standards are already met.
So QA is, are we meeting the standard?
Yeah.
And QI is, how can we exceed the standard or just do things fundamentally better?
Precisely. It's that sort of relentless drive for excellence, continuous improvement.
Okay, so if that's the big idea, always aiming higher, what are the core principles, the things that make QI actually function? What do we need to grasp there?
Right. Well, a really foundational principle is that QI has to be deeply patient-centered.
Always starts with the patient.
Always. Their needs, their experiences, their health outcomes, that's the focus. It's always asking, how does this help the patient? How do we deliver the best value, the best results for them?
Makes sense.
Another huge element is teamwork. QI just doesn't work in a silo. Right.
It needs strong collaboration across everyone involved: doctors, nurses, pharmacists, administrators, the cleaning staff, everyone. They all have a piece of the puzzle.
You need all those different perspectives to really see the whole picture, I imagine.
You absolutely do. You miss things otherwise. Then, what else? Measurement. Hugely important.
Data again.
Data again. QI relies heavily on collecting and analyzing data systematically. And it's not just about, looking back to justify something you already did.
Yeah.
It's about using data up front to figure out where you need to improve and then using it to track objectively if your changes are actually working.
So using data to guide the improvement.
Exactly. And then there's this idea of systems thinking.
Systems thinking.
Okay, what does that mean in this context?
Well, healthcare is just incredibly complex, right? It's like this giant web of interconnected processes, people, departments.
Definitely.
Systems thinking pushes us to look at how all these different parts interact and affect each other. So, for instance, instead of just asking why one nurse made a medication error.
Focusing on the individual.
Right. Instead of that, systems thinking looks at the entire medication process, from the moment the doctor orders it to how the pharmacy dispenses it, how it's delivered, how it's administered, looking for weak points in the system itself.
Ah, okay. So you're not just zooming in on one potential mistake or one person. You're looking at the whole Rube Goldberg machine of how care gets delivered.
That's a great way to put it. Exactly. And building right on that, QI really emphasizes improving those systems and processes rather than just blaming individuals when things go wrong.
Less blame, more fixing the process.
Precisely. The underlying idea is that mistakes often happen because the system is flawed, not just because someone wasn't careful enough. If you fix the process, you can prevent errors before they even happen.
Proactive, not just reactive.
Exactly. And like we keep saying, that data-driven approach is just non-negotiable. Decisions have to be based on evidence, on the data you collect and analyze. Gut feelings aren't enough.
And I think you mentioned earlier, it's not like a one-and-done project. It's continuous.
Oh, absolutely. That's maybe one of the biggest hallmarks. QI is a continuous, iterative process. It's ongoing.
Like a cycle.
Exactly like a cycle. It involves these loops of testing, checking the results, tweaking things, trying again. A classic example is the PDSA cycle.
PDSA, Plan, Do, Study, Act.
That's the one. You plan a change carefully. You do it usually starting small. You study the results rigorously, look at the data, and then you act based on what you learned.
What does ACT mean there?
Well, ACT could mean refining the change, making it better based on the study phase, or if it worked well, scaling it up. Or if it didn't work, maybe pivoting, trying a completely different approach.
Okay.
That simple cycle PDSA, it's like the engine driving that iterative improvement.
No.
Constant learning, constant adapting.
Got it. So those are the big ideas, the principles guiding QI. But how does this stuff actually look on the ground in a real hospital or clinic? Can you give us some concrete examples?
Yeah, absolutely. Let's go back to that emergency department example. Long wait times, right? A common headache.
Definitely something patients notice.
For sure. So a QI team might start by literally mapping out the entire patient journey, from walking in the door to getting admitted or going home.
Charting every step.
Every single step. By visualizing it, they can often spot the bottlenecks. Maybe triage takes too long, or perhaps there are delays getting lab results back.
Finding the log jams.
Exactly. Once they identify those problem spots, they might test a change, like maybe implementing a fast-track lane just for patients with less serious issues.
Okay, try something specific.
Right. And crucially, they'd collect data. Wait times before the change, wait times after. See if it actually made a difference objectively.
Measure the impact.
Measure the impact. And if the data shows, yeah, this fast-track thing really cut down wait times significantly,
Then you roll it out more widely.
then you might decide, okay, let's make this standard practice for the whole ED.
That makes it much clearer, seeing the process. What are some other areas where you see a lot of QI work?
Oh, it's everywhere, really. Medication errors is a huge one. So QI initiatives might involve things like new double-check protocols for pharmacists and nurses before giving meds.
Adding safety layers?
Exactly. Or think about surgery, enhancing surgical safety. Using those standardized checklists before, during, and after operations to make sure nothing gets missed.
Like the airline industry uses.
Very similar concept, yeah. Infection control, massive area. QI projects focused on boosting hand hygiene compliance among staff or finding better ways to clean patient rooms and equipment.
Preventing hospital-acquired infections.
Absolutely. The applications are they're incredibly broad. Pretty much any aspect of delivering care can potentially be improved through QI. So, okay, we get the what and the core ideas. Now, how does this actually get, pushed forward, encouraged?
Yeah, it sounds like a lot of this comes from inside the hospitals and clinics themselves. But what about outside forces? Are there organizations that promote QI across the board?
That's a really key part of the picture. Yes, absolutely. Organizations that accredit healthcare facilities like the Joint Commission here in the U.S. or NABH, the National Accreditation Board for Hospitals and Healthcare Providers in India, they play a huge role.
NABH in India?
Yeah. And what they do is integrate these core QI principles right into the standards that hospitals and clinics have to meet to get accredited and, importantly, stay accredited.
So getting that accreditation isn't just about ticking boxes on a form. It's actually tied to improvement.
It's meant to be much more than that, yes. While, sure, there are specific standards you have to demonstrate you're meeting.
The compliance part.
The compliance part, right. But the underlying philosophy, the real goal behind these accreditation processes, is to actively build and nurture a culture of continuous quality improvement within these organizations.
Fostering that mindset.
Exactly. Take NABH in India, for example. Their standards specifically include quality indicators focusing on really crucial things: medication safety, preventing infections, patient rights.
Core patient safety areas.
Right. By building these expectations right into the accreditation framework, they essentially nudge or maybe strongly encourage organizations to make QI a fundamental, ongoing part of how they operate.
So the message is, Constantly improving isn't optional. It's just part of being a good healthcare provider.
That's the idea. That's the goal. And it's not just about setting standards. Often these bodies also share best practices they see across different places.
Learning from others.
And they provide resources to help organizations with their own QI efforts. And we actually see this reflected in what people working inside these hospitals say.
Oh, interesting. You mentioned sources earlier. We have some firsthand accounts, people who've gone through accreditation.
We do. We heard from Debbie Hoffman. She's the VP of Patient Services at Mosaic Medical Center. She described her experience with the surveyors, the people from the accreditation body, as being really collaborative.
Not adversarial.
Not at all, according to her. She said they actively shared examples of best practices from other hospitals. They were open about any concerns they found, and it was a genuinely helpful dialogue.
That's encouraging.
Yeah, her takeaway was that the accreditation body was really there to support them in aiming for the highest standards of safety and quality. It underscores that idea of partnership for improvement, not just, an inspection to catch you out.
That's a much more positive frame than maybe some people assume. What other perspectives did we find?
Well, Edna De Leon, the VP of Quality at Martin Luther King Jr. Community Hospital, she pointed out something different but just as important.
Okay.
She talked about how they used the specific measurements and data required for accreditation as a tool to benchmark their own hospital against industry norms.
See how they stack up.
Exactly. It helped them understand their baseline performance in key areas and then set specific data-driven goals for where they wanted to improve. So the requirements themselves actually spurred on their QI work.
Using the framework proactively.
Right. And one more, Brandy Amendolia, who manages accreditation licensure at Wellstar Cobb Hospital. She mentioned how working with the accreditation body actually made the whole process feel smoother, more supported, and ultimately set them up for ongoing success in their quality work.
So it sounds like these accreditation bodies really can be a powerful catalyst for QI, giving both a structure and that ongoing push.
Definitely seems that way from these accounts.
Okay, so this is all really inspiring, thinking about systemic improvement. But for someone listening, maybe feeling motivated, but also a bit like, where would I even start? What are some practical first steps? How can you begin with QI, even maybe in a small way?
That's a great question. Because you definitely don't need to boil the ocean, right? You don't have to fix the entire healthcare system tomorrow.
Start small.
Start small. A really good first step is just to pick one single process, or maybe a specific pain point that you or your team run into regularly.
Something manageable.
Something manageable. It could seem minor. Maybe it's the way you order certain supplies or how patient info gets handed off during shift changes. Something concrete.
Okay, find that one thing. Then what?
Then the next really crucial step is get the people involved who actually do that work every day.
The frontline staff.
Exactly. They're the ones who know the process inside out. They know the challenges. They often have ideas for how to make it better. Remember, QI is a team sport.
Involve the experts, the people doing the job.
Absolutely. After that, try to figure out something meaningful you can measure, something related to that process that you can actually track.
Back to data again.
Back to data.
Yeah.
But it doesn't have to be super complicated statistics, just something that gives you an objective clue about whether any changes you try are actually helping.
Got it. Measure something relevant. And what if? What if the first attempt doesn't quite work or doesn't get the results you hoped for?
That's completely normal. That's actually part of the process.
Failure is an option, or at least learning is.
Learning is the key. The most important thing is just to start. Your first try doesn't need to be perfect. Honestly, it probably won't be.
Right.
The real power is in that iterative cycle we talked about. You learn from every attempt. You study what happened, figure out what worked, what didn't, and then you adjust your plan for the next try.
Keep refining.
Keep refining. It's that continuous loop. Learn, adapt, improve, repeat.
Okay, so bringing this all together then, for our listener, what's the main takeaway? The central message about quality improvement in healthcare?
I think the big message is that quality improvement isn't some endpoint you reach. It's not a destination. It's really an ongoing journey.
A continuous process?
A continuous commitment, yeah, to making healthcare better, safer, more effective, more focused on the patient. And that benefits everyone, the patients, obviously, but also the doctors, nurses, everyone working in the system and the system itself.
And it's driven by that systematic, data-focused approach.
Exactly, with the patient always, always at the center of it all.
So as you're listening and reflecting on this deep dive, maybe think about how these ideas, continuous improvement, data, patient focus, might connect with your own world, your own experiences, your work, even if you're not directly in a clinical room.
Yeah, it really comes down to having that mindset, doesn't it? Always looking for ways, maybe even small ways, to make things work a bit better.
Hmm.
Which actually leads to a final thought, maybe a question for you, the listener, to chew on. Thinking about this emphasis on always improving, using data, what's just one small change, one small opportunity you can see for making things better in a healthcare experience you're familiar with?
Could be anything, big or small.
Anything, something you saw as a patient, maybe helping a family member, or even something in your workplace if you're in healthcare. Just identifying that one small thing. That could be the start of understanding QI in action, maybe even contributing to it someday.